Hey guys, hello and welcome to my YouTube channel. I hope that you are doing absolutely fine and your preparation for USMLE or PLAB is really going great. In this video, I am just talking about O.E.T exam and how to, just pass the O.E.T exam by putting like minimum effort and getting the maximum results in like 5-6 days. I recently gave my O.E.T exam and I passed all the sections in one go and got the grades of B in all the sections. And for PLAB as well as for ECFMG certification, you need this B grade in reading, listening, writing and speaking. But for ECFMG, the writing part, they are not that hard with writing. They just need you to score 300 in writing section, which is I guess C+. Okay, so in this video, I will be talking about how to really master this O.E.T in like 3-4 days and get the maximum results out of it, because I did preparation for O.E.T for just 2-3 days and I gave the exam and got good results. So O.E.T exam, it consists of 4 sections. One is reading, one is listening, one is speaking and one is writing. So in all these sections, for example in reading and in listening, okay, not in speaking and writing, those are different, but in reading and listening there are subsections. For example, in reading you will have part A, part B, part C, part D. The details are in official O.E.T website. I am just giving you the gross idea and what resources you will be covering and what will be the overall strategy. So reading and listening, they are the easiest part. Okay, if you have your med school where the things are taught in English, then it is a cakewalk for you. I would say there are no resources required for reading and listening. What you have to do is just go to the official O.E.T website. Over there in the O.E.T medicine section, there will be a sample test. Okay, just attempt the reading sample test and just attempt the listening sample test, and I guarantee you will just get the idea like, oh, this is how easy reading is, this is how easy listening is. And honestly, you don't need much practice for reading and listening. I would say reading, no practice at all, just give the sample test. But for listening, yeah, there are like 3-4 sample tests on the official O.E.T website. I will just say that just attempt those 3-4 samples and just get the idea like how the exam is going to ask you the listening thing. Now, the real part is speaking and the real part is writing. Okay, so these are the difficult part. Speaking, I got a good grade in speaking, like I got 400 plus in speaking, so that is a really good score. So I would just share what I did in like 2-3 days and what could work for you also in 2-3 days. Okay. So actually what happens in speaking is that we are given 2 cue cards or 2 case cards. These are actually the scenarios, okay, or the patient encounters. There will be an interlocutor and there will be a cue card to you. The interlocutor will have his or her own task and you will have the own task. For example, in the tasks of the interlocutor, it might be written that you have to go to the doctor and you have to talk about how to reduce your weight, and in your task it must be written that okay, you have to advise that patient that you have to do regular exercise. In your task it would be written that the patient is non-compliant. In the task of the patient it would be written like act as if you are non-compliant and finally agree to what the doctor says. So you have to imagine that situation and act accordingly. But you cannot be straightforward in saying that okay, you have increased weight, I will advise you to start exercising daily. Then the interlocutor will say, no doctor, I don't have the energy to exercise. You will say, no, but you have to exercise daily. This is not how the O.E.T works. Actually, there are specific criterias in O.E.T speaking. Like there is something which is called as empathy, there is something which is called as paraphrasing, there is something which is called as information giving, there is something which is called as information gathering. So these might look like, oh, what this non-medical stuff is, but listen. There is a channel called as official O.E.T. After this video you will go to that channel. Okay, so there is a channel called as official O.E.T and on that channel there is a tutor whose name is Jay. Okay, so I will advise you for speaking, you have to listen to Jay's video. Okay, so that person has 2 or 3 videos specifically dedicated to speaking, and what I did was I specifically made notes from those videos. Like he will say, first of all, you have to open the conversation. So you will say, hey, hi, good morning or good afternoon, my name is Dr. X, and I'll be taking care of you today. So I just made notes on a notebook, like, okay, whenever I get the patient, I have to start like this. Then on the second thing, then on the second line, he will teach about how to do the next thing. Like, you will ask the patient, what brings you here today? So I wrote that thing down. And similarly, he will just talk about what are the other things. Like, you will ask about the information, don't ask the leading question. You will ask, okay, tell me what happened. Then the patient will say that thing happened, and you will say, oh, this happened. Okay, so he will explain to you like what you are supposed to do. And I made the notes, and like for 1 to 2 days before the exam, I just kept on revising those things in my mind. Okay, when I will get the patient, I will say this, and this is how I will conclude the whole thing. So for speaking, you have to go to that person J on on E2OET, okay, YouTube channel. So reading sample test, listening sample test, writing, speaking, Jay will take care of this, and we are left with writing. Okay, so like what the idea is about the writing. For example, if you have been in your hospital or your ward postings, you must have seen the resident doctors over there, they are writing a call to other department. Let's say they are writing a call from cardiology, they are writing a call from nephrology per se. So what do they do? They just give in the first paragraph, they just give the details of the patient, then what is the specific problem, and last what is their request. Okay, so now in the O.E.T exam, there are actually 3 types of writing tasks which are you asked. Okay, for example, there may be a referral letter. For example, you have to refer a patient to neurosurgery. For example, you are a GP and you have to refer a patient to endocrinologist. You are a GP, you have to refer this patient to obs-gynae. So there will be referral letters. Second, there can be discharge letter. You are the GP, you are you are the specialist, you are discharging this patient, and the rest of care has to be taken by the GP. So you are writing this letter to the GP of this patient that okay, you have to do like this, you have to do like this. And the third letters are maybe of you are asking someone to pay a visit to the work site and advise like what kind of work a patient can do or not. So referral letter, discharge letter, and the other one. Okay, now for writing, again, E2OET JAC has a video maybe of like 30 minutes in which he talks about what should be in your mind when you are about to write something. Okay, what to take from the case notes and how to write the information. So what you will do is you will watch that video specifically for writing, and after that you will come to the official website of O.E.T, and on official website of O.E.T there are only 5 sample letters. Okay, and what you have to do is like you have to read those letters again and again, and you have to use those same phrases in your actual exam. For example, in the O.E.T, when we write everything, then in the last we'll write that if you have any questions, please don't hesitate to reach me out or to contact me. Or when we start the letter, we start by writing okay, I am writing this letter to refer Mr. X to your care for further management and treatment. So there are some specific phrases, and there is specific I would say specific type of phrasing, like where you place what, where you place the date, where you place the subject, where you place your name, where you place the receiver's name. So in that video everything has been taught, like what should you do, like where should you place those things. So all you have to do is just watch that video and come to the official OET website, and there are 5 samples, and you have to just memorize the phrases written in those 5 samples, and 95% of the times you will get a referral letter in your actual exam. So this is how you are going to, just attempt the OET in 2 to 3 or 4 days maximum. And I know many person who did the same things, and all of those people, they got the good grades. And I am hopeful that you will also get good grades, provided you can handle speaking and you can handle the writing thing from Jai. Apart from that, there are various groups on telegrams in which people are doing speaking practice, or you can also like just attempt to speak to one of those people who are having the exam in the same date. And that is how I approached O.E.T, and these are my major advices for you if you are going for O.E.T in next 2 to 3 days. Apart from that, I will attach some files in the description box, in which I have just I use those files for writing subset, but I don't know whether they help me much or not. But specifically, you just stick to those samples which are given in a website. Okay, so this was all about OET and how you attempt the OET. I hope you do really great in your exam, and thank you so much guys. Hope to see you in my next video.